All right. Hello and welcome everyone to today's webinar, The Key to Modern Practice Management and Accelerated Revenue Cycles. My name is Jacob Borkover here on the webinar team at Rectangle Health, and just want to thank everyone for taking time out of their days to be here with us today. And of course, a big thank you to our friends and partners at CareStack for joining us today and putting on this webinar with us. So we've got a great presentation for you in store. Before we jump into things here, just wanted to give a few quick housekeeping items. Always get a bunch of questions, so try and address them before we get them. So we are going to be sharing a recording of the presentation with all of you. So if you have someone else from your practice that would like to join, or if you need to hop off a little bit early, we are going to be sending off that recording within 24 hours of today's presentation. So be on the lookout in your email inbox from whatever email you registered for today's presentation with, and you'll see that webinar recording along with the webinar slides and other follow-up materials. We are going to have this be a little bit interactive, so there will be a polling question or two throughout the presentation. We'd love it if you could participate, and also if you have any questions throughout, don't hesitate to put them in the chat or the question tab, and we will answer them when we get an opportunity. At the end of the presentation, there will be a survey. We'd love it if you could fill that out, let us know how we're doing, and so we can continue to provide you with the best webinar content and get suggestions for any new topics that you'd find interesting for your practice. And then if anything in our presentation today sparks your interest, we're going to be talking through a lot of great things that are going to help your practice. We will be placing a link in the chat for a demo, so someone from our team will reach out to you with more information on how we can get you started with that. So, and like I said, if you have any questions at all throughout today's presentation, just drop them in the chat and we'll answer them as soon as we can. So with that, I'm really excited to introduce our speakers today. Dan Hall, who's a director at CareStack, has been with CareStack for the past 6 years. In his role, he helps dental practices of all sizes with software solutions and professional services that increase their productivity, efficiency, and profitability. And we have James Swan, who leads the enterprise team at Rectangle Health. In his role, he assists practices in finding solutions for revenue cycle management, patient engagement, and compliance that best fit their needs. So with that, James, I'm going to have you start us off.
Awesome. Appreciate the introduction and look forward to today's conversation with Dan. So next slide, please. Awesome. So where I always like to facilitate or begin these conversations, on the Rectangle Health side, we've been in the marketplace for a little over 30 years. And through that time, we've seen a number of changes and twists and turns, if you will. But I think it's important to understand some of the history around what we've done in our place within the market to understand some of why or how we've gotten to where we are. So with Rectangle being around for a little over 30 years, the first 20 years of that were focused almost exclusively on patient payments and specifically kind of merchant services. And in 2012, we migrated or shifted that philosophy and that thought, and we deployed our now proprietary software known as Practice Management Bridge. And it was designed to do one thing and one thing really efficiently, and it was to bridge that gap between the collection of patient payments and ultimately getting that posted back into any practice management system on marketplace. And since that time, obviously, over the last 12 years, we've continued to refine, adjust, adapt, enhance that solution. And ultimately, what our goal today is to be is anything that the practice management system may not be. And we've had an opportunity to kind of fill out this unified platform to be able to deploy a number of different technologies, as Jacob referenced, in not only patient payments, but also focusing on compliance as well as some engagement tools as well. So we're going to talk a little bit more about that history, focusing a lot today on accelerating that revenue cycle. So next slide, please. So what makes us different? One of the big things is really that scale and that size within the marketplace. Being in the market for the last 30 plus years, we've acquired over 44,000 healthcare providers who utilize Practice Manager Bridge in some capacity. And when we think about why that's so impactful is really this idea around the expertise and what it takes to be a payments partner, but also a payments expert. And that's going to fall into a number of these kind of buzz lines or catchphrases, whether it comes to the comprehensive nature of our technology and its scalability. When we think about one location, Dr. Smith DDS, all the way through into the largest healthcare organizations in the US today, our solution is really able to fine tune and specifically solve the challenges of a complicated revenue cycle management process for our partners, regardless of the size of their organization. And one of the big benefits as to how we become and how we are so scalable is this idea of our technology being so simplistic and easy to use. We'll show us a couple screenshots, but really it's this user interface that's designed to be very intuitive. And in many cases, as we've seen over the last couple of years, when we bring on new FTE individuals, whether it be at front office or back staff, having that simplicity and having that technology that not only enhances the patient experience, but doesn't do so by impacting your staff is really that perfect synergistic solution to benefit both ends of that equation. And then obviously doing so in a secure fashion is always pivotal and really impactful. So next slide, please. So simplifying administrative tasks, and really we can talk about a lot of the technology and a lot of the impact that Rectangle is able to have on that market, but really hearing of it from our partners is really the what we love to see. And as you can see, a couple little snippets on the right there, a couple that I wanted to draw some eyeballs to, if you will. And it's this idea that we're able to save 5.2 hours per week collecting and posting payments by utilizing Rectangle Health and Practice Manager Bridge, and that's on a per location basis. So if you can extrapolate that when we talk about multiple locations, when we talk about a number of different factors, we're talking some very significant FTE reductions that can do a number of things, either potentially having the ability to replace some of that burden on the staff themselves. But more importantly, we're able to turn that into other revenue generating activity, putting more time and putting more energy into case acceptance or ensuring that people are coming in and we're filling more butts and seats, and we're looking at this rev cycle from start to finish as more than just collecting payments, if you will. And one thing, kind of through a number of these different components, as you can see, we've got the ability to consolidate multiple vendors down into one. We've worked with groups that have 12 multiple vendors across their number of locations. We've worked with some that have 2 that we can consolidate to 1. Anytime we're able to find those consolidated efforts and bring those conversations down, not only are we potentially looking at economies of scale and being able to save some financial impacts, but the other benefit is when you're working directly with one organization who knows your business intimately, we're able to make recommendations and have some of that consultative component specific to those relationships. And when we think about kind of what we're truly solving for, we want to obviously give patients optionality in the way of how they interact with practices. Think from a payments perspective, think providing or offering text to pay, thinking dynamic links for online bill pay, potentially using QR codes if we're deploying physical statements. All those options are going to impact the patient and actually provide a better patient experience. But it's also going to have a couple other trickle-down effects. When we leverage technology, we're able to go and capture and actually bring in that revenue in a much faster way, dramatically reducing our dependency or our outstanding AR, increasing and benefiting that rev cycle time. But we need to do so in a way that is not negatively impactful of the staff members themselves. So we want to give patients options, but we need to do so in a way that still automates the technology for our employees to get those payments and that information back into the PM system. So not only does Rectangle offer options for patients, but we can do so by still automating that information using our technology Practice Manager Bridge back into that PM system. And then last but not least, when we think about having all information and that access to data, how do we then take that information, that access to data, and ultimately ensure that we can make better, faster, more informed decisions against that? So that's really the 3 buckets that we're trying to solve for with our technology. Next slide, please. So when we think about bridge payments, so again, bridge payments falls under our bigger picture, or bigger product, Practice Manager Bridge. We're really looking to do a number of things. We're trying to save time and improve efficiencies, like we talked about, faster access to cash. We want to enhance the patient experience by giving them those options, making it feel like any other retail experience that they may be involved in. We're going to find better results, better patient experience, all the above. And then improve practice profitability. Hopefully, as we've kind of talked talked and touched on, all these things have trickle-down effects. So when we are using and leveraging technology to improve the patient experience, to capture that access faster, we're going to improve profitability because of those different things that are happening. And then last but not least, our technology is built in a cloud-like environment, and we protect and remove the financial impact from our partners related to very pertinent and protected patient information. So because we use P2P encrypted technology, because we manage PCI compliance on behalf of our partners, because we have PCI compliance at the gateway level, we're able to give time back, but also we're able to give peace of mind in knowing that your partner is managing those critical pieces within the process to ensure that we're not making anybody liable or putting anybody on the line from a financial risk perspective. Next step, please, or next slide. So what is deployed within Bridge Payments? So Bridge Payments is a number of different things, and as you can see on the left there, those are all the different feature sets. And as we've talked about, when we deployed our technology at inception in 2012, our feature set was obviously far shorter. And why I want to talk about that is with partners, and it's one of the reasons why we did partner with CareStack and we love their solution, is we want to deploy and work with like-minded organizations. And CareStack has a similar philosophy in that we're not just going to deploy something and then sit on it. We're constantly evolving. We're constantly hearing about what is the next thing in market that's going to help and improve our practices, acceleration of revenue, or enhance their operations within the clinic itself. So as you can see, obviously the ability to collect in-person, online, text, and phone payments, with also, again, that connectivity point back to the PM system. The ability to create subscription plans or custom recurring payment plans. The ability to store cards on file. I'll tell a small quick story about one of the feature sets within our product that is having dramatic impact, and it's the ability to store tokenization or store card on file. When we capture that card on file, within our technology, we can also store what's called a pre-authorized healthcare form. And that pre-authorized healthcare form essentially is our patient giving our practice consent to charge that card on file up to a specific threshold for services provided. Why that's important is going back either a year or two at this point, the federal government rolled out new mandates that states any healthcare responsible payment that falls under $500 no longer is able to be reported in a negative credit impact back to the bureaus. And what that means is any collections under $500 become increasingly more difficult to capture for those specific reasons. So when we capture card on file, we're giving patients a better experience because that's where the modern day is. When you go to stay at a hotel or you even reserve a restaurant reservation, more times than not, they're asking you to put card on file already. So patients alike are experiencing this in their daily life. They should be experiencing it in their healthcare environment as well. And then to take that one step further, if we can text that patient to say, hey, we've got card ending 5111, we've got a $30 balance, we're actually going to charge that card on file because of that pre-authorized healthcare form. That patient's actually going to feel that value because they don't have to do anything. It's automatically happening in the background, and we're just simply allowing technology and letting technology work for us. As we talked about, QR code payments, full reporting suite, and contactless options like Apple Pay and other digital wallets. Again, giving those options. The one thing that I skipped over, and maybe purposefully because we can talk about it a little bit more, is this idea of straight through processing. So when we think about the insurance side of it, the payers right now, in a lot of cases, you're capturing insurance payments via one of three ways. You're either sending in an EFT to your office, you're getting physical checks, or you're receiving a virtual credit card. What we deployed in tandem and in partnership with our partners at Zealous is this idea of straight-through processing. And what that means is we can take any form of those and automate that process to collect that EOB, the explanation of benefits, the explanation of payments, and automate that back into the system of record, reducing any manual involvement and removing that piece from your staff, while also ensuring that as soon as day zero happens and you are approved for those funds, they end up in your bank account, and you're not having to wait or have any lag between approval and payments. So we've seen a ton of positive momentum around access to cash and getting those things, especially with the recent impacts tied to the Change Healthcare stuff at the beginning of this year. So that's just one example of new technology that we're constantly deploying into the marketplace to benefit and improve and enhance our partners' portfolios. Next slide, please. So how do we think about the different options related to Rectangle Health and ultimately how we play in the marketplace? So Rectangle Health, again, is a technology partner with the ability to integrate into the market. And with our partners at CareStack, we ultimately have an embedded relationship in which our technology is deployed within the CareStack ecosystem, and then being able to leverage some of those additional features like text to pay and online bill pay and those things happening and being powered by Rectangle and our solution and bridge, really, again, finding the best of both worlds, giving as many options to those patients as possible without impacting the other side. But there are a couple other options in the marketplace when we think about payment options. And you've got your traditional non-integrated payment solutions. A lot of times these are relationships with local banks or similar. And where Practice Manager Bridge and where Rectangle is going to provide significant efficiencies and enhancements are not only being able to streamline some of those collection efforts via patient optionality, but again, taking that and then having it automatically work back into that PM, the EMR, the EHR solution. And then the last, if our partners are using an embedded payment solution, I would challenge to say, hey, are we missing opportunities around some of those other features? Because in a lot of cases, and maybe CareStack excluded, just because of that relationship that we have, we can give the best of both worlds. But in some cases, if you are using or leveraging technology that maybe does not offer some of those ancillary benefits like text to pay and some of those other things, asking the question, why not? Where are those limitations? So as you can see, there's a number of benefits to using a technology partner like Rectangle Health. And this slide is a really powerful one. I challenge anybody following this demonstration, go back and look at this slide specifically. There's a lot of value and there's a lot of power in those words. So this is a slide that I would challenge everyone just to go back and kind of dive a little deeper into, because I think there are a lot of great takeaways. So next slide, please. And then as we talked about, within the last couple of years, we've really challenged ourselves to broaden the solution. And Practice Manager Bridge, which used to be almost a payments exclusive ecosystem, now does deploy technology for compliance and technology for engagement. And when we think about bridge compliance, it's really this idea of how do we ensure our electronic PHI is safe? How do we maintain a safe workplace for OSHA compliance? And then it's really making compliance a priority. Again, the one thing that I so frequently hear with all of my conversations are compliance is being managed by a member of the staff, and in a lot of cases, it's the fifth, sixth, seventh hat that individual may be wearing. And what Rectangle can do is we can deploy a very easy and simplistic compliance solution, all within this one unified platform, to ensure that we're no longer at risk, or we're able to take one of those hats or one of those requirements off of, whether it be an office manager or regional manager, or even potentially somebody in a different capacity. So really, really powerful tools that allow, again, just automation to happen in the background. So we're not having to even have it be a thought process for our team members to ensure compliance at our location. Because as I think everybody knows, at this point, we want to avoid and minimize any of those potential risks or potential issues, because those will have financial implications far down the way. So next slide, please. And within our compliance solution, we really focus on a few things. So it's obviously HIPAA compliance for all of our employees within the organization. It's OSHA compliance, as well as things like BAA certifications and the management of those relationships. It's PCI compliant management. If you're not using our payments technology, we can help manage some of those PCI components for you. It's a robust 1,300 credit CE credit library in which it's going to be that central database in which you can pull from and report out against, but a number of different great CE options within that, and it all comes within one singular platform and one singular solution. And last but not least, this cyber liability insurance, really, again, removing that risk as much as we possibly can for our partners as they think about compliance within the practice. So with that, I'm going to ask for the next slide, and I know it's a question slide. I know we kind of had talked, we're going to save some questions for the end, but if there is anything quickly, we'd be happy to answer anything. And if not, I would love to transition this over to our partners at CareStack and Dan Hall. But I appreciate everyone's time and look forward to continuing the conversation.
Yeah, James, I got two questions that just came in here for you. One says,
Fantastic.
we recently brought on new technology. Can Rectangle displace those different relationships? And can you just talk about that a little bit further, what that would look like?
Yeah, it's a great question. So we frequently get into the door maybe right after somebody just says, hey, we recently onboarded and there's some potential risk of this idea around change management and ensuring that employees are happy. And the reason why, and maybe I'm hopefully taking the question in context here, but what Rectangle is able to do is we're able to, again, offer consolidation. And while some of these relationships that may be new in nature and are just starting, it likely is kind of an additive component, and we're talking about a third or fourth or fifth vendor sometimes. And what Rectangle is able to do is, even though we do become a new partner within the ecosystem of our relationships, we are able to remove as much or as little of those competing solutions and technologies in the marketplace. So the answer is yes, regardless of if you recently signed on with a new organization or have had a partnership for a couple months, years, what have you. We would love to facilitate a conversation to understand what type of consolidation we might be able to deploy and provide our partners in the market.
Perfect. We'll do one more question here and then we'll move over to Dan. This is a HIPAA compliance question. It says, we just bring in a HIPAA and OSHA trainer once a year into the practice. Does that meet our requirements? And what do you recommend we do moving forward if it doesn't?
Yeah, it's a great question. So the answer is yes, it depends. So the unique thing about deploying technology in this instance, there's a couple benefits from my perspective. And it's one of those scenarios in which if you bring somebody in, that largely happens at one day. And potentially we're talking about risking production for a 4-hour capacity or whatnot. And the trickle down impacts of that are obviously revenue. That's a big piece, that when we bring somebody on site and we have all of our staff members there, we're taking a large initial investment, and we're also not able to monetize that day. And then the second piece is if somebody comes in a week later, all of a sudden they now have to wait a full 12 months before they're able to go through a lot of those same classes, those same accreditations, things like that. So it's not to say that you're not doing it correctly, but the value of technology and the ability to deploy technology at the point in time is really one of the benefits of utilizing our compliance solution. Is as soon as somebody joins or steps into your organization, we're going to offer them all those different requirements to ensure that your staff and your organization maintains compliance without needing to necessarily take them out of the field or allowing them to do some of those things during downtime. So we're not impacting a full half day of production or what have you. So happy to dive a little further into that question at the end if we think appropriate, but I hope that does suffice for an answer there. But
cool. Thanks, James. We'll handle any other questions here at the end, but we'll kick it into Dan. Dan, take it away.
Jacob, James, appreciate the introduction. Thank you all who are attending. Here's a little history on CareStack on the first slide that we have here. Just wanted to give some background, and this will kind of tie a little bit later as we go into some of the subsequent slides on the partnership between CareStack and Rectangle Health. But you can see we were started in 2015. We are a true software company. We had a doctor who contracted our software company to develop integration into existing practice management softwares for sleep apnea software and device. And when we saw the fragmented nature of the space and all these on-premise solutions and the legacy practice management softwares, saw the need for a modern cloud-based solution that brought it all into one single solution to provide better reporting, the opportunity for more scheduling of treatment, and improved revenue cycle management. That's where CareStack was born. And you can see if we fast forward to today, we're operating in the US, we expanded to the UK, Australia, Singapore. There's some of our strategic partnerships like the Strumman Group. We're in over 2,500 practices, have a pretty solid reputation in the space, and over 900 employees globally. So, Jake, we can probably jump to the next slide. Just wanted to give a brief history of CareStack and how we got to where we are today. And here's what we do at CareStack, right? Because there's a lot of talk when we look at practice management software, and James, I think, covered this pretty well in his side, how it's a broken ecosystem, right? You'll have a legacy system, and then sometimes we see practices adding on 2, 3, 4, 5 different softwares to effectively run the practice. So you'll see on the software side here at CareStack, we're going to cover the core PMS, payments, memberships, CS conversations, and our portal. And then we also have the connection in with Rectangle to manage the payment side. Then we also have our services to fill the void. One thing we are starting to see as we are deploying more and more of CareStack is a lot of the practices weren't insulated from some of the challenges that exist out there when it comes to labor. Just like any other business in the space, we had virtual assistants that came into play, and these are virtual assistants that are experts on CareStack, right? Looking at maximizing conversion rates on phones, reactivating patients, taking inbound calls. And in that process of standing up that team, we also built our next product, which was our AI phone system to track those conversions and help us manage that team, and is now a product in the CareStack offering. Just like Rectangle, our good partners, CareStack is constantly developing as well too, to bring out products to enhance the revenue or collect the revenue faster within the practices. And that's where we roll into our care revenue division, which is to help in that process of kind of like what James was saying, if we have people collecting patient payments, it's the same on the insurance side, if not a little bit more challenging and time consuming to take that and push that to another team and take that internal team and make them more focused on the patients that are coming in, getting that treatment accepted, making sure the phone is answered for that new patient that's looking to schedule, et cetera, and redeploying those resources internally within the practice so we can maximize what we're getting out of our existing base of customers and new ones coming in. Jacob, we go to the next slide. We'll dive a little bit deeper into what the core product is at CareStack and what we're seeing practices looking for when they make the switch to a new practice management software within the dental space. On the left-hand side is the ecosystem of CareStack. And I know it looks daunting because we display so many different services out there and the modules that we have within CareStack. But what the goal was there to have a single all-in-one software that's easy to use, has reliable support, is safe, secure, and scalable, which CareStack does check all those boxes. And when we have that reliable support as well, too, we also understand that everybody may not adopt what's on that left-hand side when they first start out with CareStack. So I'm going to dive just briefly into what that onboarding process looks like, not to be presumptuous that this whole group is going to adopt CareStack, but it is something we get a lot of questions about, is what does that look like, right? Because today I may not do online appointment booking, or I may not do a patient portal, but I may want to grow into it, right? So we do have a team that is set up to make your team successful day one. And then we attach every office to a client success manager that can meet with them to adopt future modules down the lane that might take a little bit more operational know-how or thought to make sure that we're doing online appointment booking for the right types of procedures and giving access to those patients to the right production calendar, so they're only booking into the category that makes sense. So you don't ride alone, right? So you may not do it all today. We can always deploy it in the future. ERAs would be another one, right? A lot of folks want to move to that. Helps you get your money faster. We can do auto posting with a dollar threshold of plus or minus X number of dollars. So this way we're not paying a $20 or $30 an hour employee to go seek, a $10 difference on a insurance payment, and they spend an hour on it. We can just look at holistically the report to see why that might be happening and go back and correct our fee schedules. And Jacob, if we could jump to the next slide, we'll jump into why we see practices changing software. Now, this was an internal study that we did at CareStack. Kind of data nerds, if you haven't already noticed, on how we like to look at the information. We have analytics built into our platform, but we also want to have a better understanding of why practices make the switch of the heart that it's essentially running the practice, being the software, right? And on the right-hand side is the information that we found. I think that was over a 12-month period, looking at what practices were talking about in conversations and what was the top reasons when they were having a conversation about making a practice management shift, right? And we can see in the top items, it's scheduling, payments and reporting and insurance, everything that looks in kind of folds into that revenue cycle, what we're talking about today. And with CareStack being able to accelerate that with a strong partner like Rectangle Health, if we can bring more people into the schedule and we can fix that scheduling issue, and then we can also improve that revenue cycle management collection through the insurance side, as well as more flexibility on the patient payment side, we're going to outperform those legacy systems, right? And we're going to bring it all into one single experience in one system. And you can see that other items that were leading to this is there are too many pricey add-ons. People were getting fatigued with having to add on 2 or 3 systems to accomplish this, better patient experience. And they need to consolidate operations potentially across multiple locations, and being able to see a schedule across, 1, 2, 3, up to 100 locations. And the same with the revenue cycle management side, being able to take insurance payments, manage claims, and also those patients' payments easily across multiple locations, and just to have that modern patient experience. I think James said it really well. I mean, you go to book a reservation at a restaurant and you're putting your credit card on file, right? I mean, it should be pretty easy to do in the dental practice as well, too, right? It's just more consistent with that experience that you're having out there when you're consuming any other product, good, or service. It's kind of where the expectation is. You can do a lot of self-serve. You can put your card on file to make it more convenient to pay. And also, too, if we can get it down where we have somebody checking that insurance eligibility well before the appointment, and we know exactly what's due, that patient's going to be more apt to make that payment on the spot, knowing that somebody checked their insurance just 24 to 48 hours ago. And again, that rolls into that broken RCM process and smoothing that out through, again, one system that we're going into versus having to jump out to 2 or 3 different platforms to accomplish that goal. And Jacob, we can jump to the next one here. We'll jump and look at some of the results. Now that CareStack is been in the space, right? We had all the data showing us why people were switching. So in the last 18 months, 2 years, we really want to take a look and see how are we delivering on those metrics, right? Are we hitting the mark in helping practices schedule more treatment, have better reporting, improve the revenue collections, both on the insurance and the patient side? And on the right-hand side is an independent study that shows how CareStack helped a good basket of our clients increase their production by 40%, reduce their days sales outstanding by 35%. And we're seeing about a 307% ROI on the investment of moving over to CareStack. So we were pretty excited when we started to dig into the numbers and look at the research to see the results that we're producing for the clients that made that shift over to CareStack and delivering on those items that had them in the search in the first place, right? That kind of clear differentiator that we saw as a cloud provider. We're pretty proud in the fact that we're delivering increased revenue to their top line and collection of that revenue, especially when we see a lot of peers in the space, pushing more to just maybe reduce a monthly cost, or say we can get rid of a server. I mean, because the last time we did the research, the server really doesn't produce anything additional on the top line revenue if we remove it from the equation, right? We have to make it a little bit easier for the staff to take action within the practice to increase that top line revenue and make it easier to collect money through things like text to pay, payment plans, digital statements that Rectangle can all produce from the Bridge platform to bring that money in faster, right? So we can reduce those number of days outstanding. Jacob, if we could jump over to the next slide. I know we're talking a lot about why people switch and what the results look like. And I know you're going to throw out a polling question. I don't know if we want to do that now, if we want to jump over to the question section.
Yeah, you can keep rolling. We'll hit the polling later.
Okay, that works. So here's some additional results, right? To back again the Forrester study, when we look at the growth-minded dentists that are making the conversion over to CareStack and some of the results they're seeing from moving over to the platform. And probably the biggest one for me is Rashida Johnson, right? That was a client that came on board a couple of years ago. Brent, an associate that was striking out on her own, just opened up a practice, was making the shift over to CareStack, was still working at her existing practice. And within, I believe it was 18 months of making that conversion over, she had only worked in a legacy system where they were using a server-based platform with a reminder system, a clearinghouse outside of it, an analytics tool outside, and then a payment that wasn't integrated in. And with that time frame of opening up her practice, she increased her production by 75%, was able to leave as an associate well ahead of schedule, and accomplish a lot of goals by moving into that single ecosystem. So again, a couple of clients and their success that they've been having on the platform of CareStack. And Jacob, we can go ahead and jump over to the next slide. We'll hop a little bit now into a couple of screenshots of like what the CareStack platform looks like and how we're helping optimize that scheduling within CareStack to deliver, again, what we're seeing practices seeking as they want to make a practice management shift, right? So we can look at the scheduling. Number one is, we can do multiple locations. So if there's anybody on here that happens to have more than one location, we can manage the schedule from a single view and we can search for open slots. So say we have a practice that's branded from a global brand, they can jump in there, quickly search the closest practice that has availability for that patient or family. Now, we are built for everybody, right? So it doesn't have to be necessarily multiple locations, it'd be the single location as well too. So we can do performance tracking as well within our product. And we also have what we call our opportunity miner, which is going to put data in front of the end user of CareStack. So within that schedule, we're also going to see on the left-hand side, there's going to be tools and resources for those schedulers that are tasked with keeping that schedule full to be able to fill it versus having to go and pull a report, right? That was the number one thing we were hearing at our annual conference called the Inner Circle, as far as feedback goes, is take your data and put it in front of my employees that are tasked with those particular objectives, right? So they can act on them in the moment. It's awesome that I have a pretty graph to look at the next day, but what I need more than that is the ability for the team to take action while they're in front of patients or they're answering the phone from a patient. Jacob, if we could jump over to the next slide, we'll move away from the scheduling component and go into the clinical efficiency side of CareStack, where we bring in the whole experience for the clinical team as well too, with an enhanced case presenter, where we can push out cases digitally to the patient to get acceptance. So maybe they're going home to talk to a spouse or a partner about that treatment and might not be sure what it was. They can log into their patient portal, send them an alert. They can view the treatment plan, what's been recommended, the cost, what the insurance estimate is, patient estimate. They have full charting and treatment planning capabilities, and we do have fully integrated digital imaging through CS imaging. And we also still give autonomy as well too, right? We're a little different than some of our peers in the fact that we want you to have the best imaging for your practice, since that's what you're making your clinical diagnosis from. So we do support about 29 different bridges and integrations into our platform to ensure that you have the best imaging solution for your particular practice to diagnose from. And Jacob, we can go over to the next slide. I believe this is where we're going to jump into the custom dashboards in the reporting and analytics side of CareStack, right? And we can see the first quote at the very top, pulled again from an end user of CareStack, wanting them to be actionable items, right? So we can see we got the great graphics on the right-hand side. But if we look at the very far right, there are lists that'll show that are items that are happening in real time. that a regional manager or an office manager or an owner doctor could coach people in real time to see, oh, great, why do I have so many people leaving without a future appointment scheduled, right? Again, it's handy to see it on the report the next day, but if we see it while it's happening live from our dashboard that we're all logged into throughout the day, we can go coach that new employee on the spot, or perhaps somebody that's filling in, to talk through like what the process is within the practice to ensure that people are leaving with a future appointment. And then again, actionable items, we do have an opportunity miner where we can go inside of CareStack, and there's about 210 different ways that we can split the data. And we might be a little bit more robust than other items because we're not attaching to anything, right? CareStack is its own system. So we have availability to all the data in the platform to be able to say, hey, opportunity miner, let's go look for patients that are between the ages of 8 and 14, have a certain condition, are in a certain zip code, and have been presented in a liner case, right? And it's going to populate everybody. It's going to give me mom or dad's name. It's going to be mom or dad's mobile number. It's going to tell me the value of the treatment plan. If I want it to, it's also going to tell me what benefits they may have remaining if they have insurance. And it's going to pump out a clean list for me that my team can go and work through. And then as soon as that person goes scheduled, if unscheduled is my trigger, once they flip over to scheduled, they would be pulled off of that list. So this way now your team has an active list they can call from, pretty much any type of patient, whether it's based on treatment, demographic, future appointment, past appointment, balances, remaining benefits, etc. So they have that active area. They don't have to rerun the report once you go and you set it up during your onboarding process. Those will live there forever, and you can always make adjustments. You can always add future ones. But this way you have a better handle on what's happening in the practice as far as treatment that might be leaving and going unscheduled. So what we were seeing a lot of, and the feedback we were hearing from when we looked at especially the KPIs, is how do we then go and put these folks into an actionable item, right? How do we populate that into a list where our staff is reaching out to them? And what we're hearing is automated systems are great, right? But that practice that was doing, full arch and upper arch at, $30,000, $50,000 cases usually took a personal touch. They wanted to call those individuals. And some of our orthodontic cases, and just even some small towns where they were very, personal with the relationships and wanted a way to reach out to them individually. So we built that opportunity miner so we can make those calls, send those text messages directly, integrated the phone system directly in. So it's a button to call, launches their phone. The AI shows the results of each one of those calls to see what type of conversion we're getting on the back end from every engagement, from inbound and outbound activity from the staff. So we could really maximize those conversions and make sure that everybody's getting the necessary treatment that they were being recommended by the doctor. And it wasn't just getting, pushed out to the next visit, the visit after that, and turning into a more severe case. So again, a full analytics tool, but again, built around being activity based. So individuals within the practice can take action on those activities throughout their day and putting it directly in front of them. Jacob, if we could jump over to the next slide, we'll hop into revenue cycle management. It's a big piece, the topic that we're talking about today. I think when we talk about it at CareStack, we tend to fall back into our usual position of insurance. I know we may have some folks that are fee for service on this call, a little bit more interested in a lot of the components that would come from the Rectangle platform that's integrated into CareStack. But I do want to cover insurance side, because again, we do have a full benefits management. So we do have an eligibility form if we're doing those eligibility checks that'll pass through any exclusions, limitations, downgrades, pre-authorizations, and automatically flag it as we're putting any type of treatment on a patient. So this way we would know why the downgrade is happening. So say we only got 2 emergency exams per year for anybody under the 20 years of age and younger, right? It's going to populate a notification for me so I can click on it and tell me exactly why that's happening. So then I can have the conversation with the patient. There's no surprise invoice. It makes it a little bit easier to collect that money on the patient side through Rectangle, and then also gives a more accurate estimate on the insurance side. And then for the claims, we have a centralized control center directly inside of CareStack. So we're bringing that clearinghouse directly into the platform and also making it where we can work the aging directly from there as well too. And we can manage both our dental and our medical claims because we do have a electronic medical claims management platform inside of CareStack with an integrated clearinghouse. So all of our claims would be in one area. Jacob, if we could jump over to the next slide. So payment processing, right? I think James probably covered a bulk of this. So I'll probably go pretty quickly through this one here, where we can do recurring payments, tokenizing that credit card. It's just a game changer. I see a lot of our practices moving over to that are on Rectangle, because when we're posting payments from our central insurance area inside of CareStack, and we also have Rectangle Bridge open, if there's a difference plus or minus on the insurance side, we can post the insurance payment, move and make those adjustments over to the patient side pretty quickly, click on the bridge and hit a tokenized credit card for the balance that's due, send a message over to the payment letting them know that the insurance payment's been posted, the patient payment's been posted to their card on file, and they're set to go. Because like James was saying, you're collecting that signature saying, hey, it's okay for anything $250 or less to automatically post to my card on file. So this way I don't have to be bothered with a statement, a phone call, or going out to my patient portal. And really smooths out that revenue cycle management process. I have one of my larger groups doing it. I think they were shaving off roughly about a day when they look at just looking at the volume. That day was just on the refunds they were giving, because they estimate high and refund back. But they were saving so much time from having to cut checks, call people, try and get cards next time they come in, etc. And then there's the full payment plans that we can do within the Bridge platform, and then integrated patient financing as well too. But Jacob, we could hop over to the next. So some of the groups and DSOs that we worked with, here at CareStack that have adopted our platform. Like I said, it's great to see that, we work with some emerging groups and DSOs, but really a bulk of the practices using CareStack are individual practices. About 67% are single practice owners up to 3 locations. And but we're built for everybody. We can scale all the way up. We're hosted on Microsoft Azure. We're a true cloud platform. So when you open up a Chrome browser, you type in your practice name, .carestack.com, and you go to a login page. So it can be infinitely scaled on the back end. But again, built for everybody, whether it's a single location, like that example of Rashida Johnson, she owns 1 location, saw a 75% increase. But Plum Dental listed up here, they collect their money 2 weeks faster because of the CareStack platform after moving off a legacy system and over to CareStack. They're getting their money much faster so they can redeploy it into other investments across different locations. Jacob, we could jump over to the next slide. Yeah, let's jump in here and see if there's any questions. I know we're going to throw a poll out there. I don't know if you had a chance.
Yeah, let's do the polling question here.
Sure.
All right. What is most important when accessing and adding new software? Is it the price of the new software, increasing revenue per patient scheduled, improved efficiency with staff, or increased collection rates for both insurance and payments? Give everyone a second here. All right. It looks like we had 12% say the price of the new software. 70% said increasing revenue per patient schedule. Wow, that's a high number. 8% improved efficiency with staff, and then 8% increased collection rates for both insurance and patients.
Wow, yeah, that's impressive that 70% just are looking to collect their money faster, right? I mean, it's what we're finding here at CareStack. James, I'm sure it must be the same in your world as well too.
Yeah, without question, I think it's twofold. It's maximizing the individual that's in the seat and ensuring that we're getting as much revenue out of them as possible, but then the process of actually capturing it and collecting on that revenue. So it's a multi-pronged approach that obviously a solution like CareStack is able to help with one of it, and then our technology is able to ensure that we're collecting on those efforts as well. So definitely powerful right now.
Cool. So I see we have 2 questions in here. So if anyone else has any questions, feel free to place them in the chat. Dan, this one's for you. Would CareStack replace Dentrix at my office?
Yeah, we get this question a lot, Jacob, and this would be a complete replacement. So we would be removing Dentrix, converting your data over into CareStack, which is then going to allow you to drop all those add-ons that you need to run Dentrix throughout the day. But yeah, thank you for the question.
And then other one I have in here is, what's the #1 thing your system does to reduce accounts receivable? Is there like one main thing in particular?
Is this directed at me again,
It
Jacob?
doesn't say, but I think
Okay.
either of you could take it.
I'll take a swing at the CareStack side, which will be on the insurance side, and then James, why don't you take the patient payment side? So when I look at the insurance side, it's nothing really fancy. It goes back to that control center that we have people working out of as they manage the entire life cycle of that insurance claim. And what we did based on the feedback is, like I had referenced Plum Dental collecting their money 2 weeks faster, is we added an aging column. Since individuals are going there every day to check on the status of a claim and to work claims, somebody's like, hey, why don't you just put aging in there? So as we're already on the phone with Delta, we can then filter out everybody that hasn't been checked up on in the last 2 weeks, go into a particular aging bucket. We can check up on all those patients at the same time. So that way helping them collect it, 2 weeks faster. Because what we were finding in the marketplace is they would only do that exercise once a month. And now they're doing it on a weekly basis. So that's on the insurance side. I'll pass it over to you, James.
Yeah, I think on the patient responsibility, when we think about aging AR, it's really just leaning into some of these technologies. And what we so frequently hear is, hey, my patient set may not lean into that. And the pushback I would definitely provide is all the data points that we're showing are, regardless of demographic, regardless of age of patient, they're looking for these things. And I'll give a quick story. My father, he's an aeronautical engineer. He's brilliant. He's not technologically savvy at all. But anytime he sees a QR code, his first instinct is to utilize his phone to hover over that. So even something as simplistic as a QR code on a physical paper statement. Now, our desire is to lean more toward texting and bulk text to pay, but even something as simplistic as that could change behavior. And that's just going to dramatically reduce those days of in AR and ensure that we're capturing those payments as quickly as possible.
Fantastic. Thank you both for the responses there. James, I'm going to send it into you. I just put a link in the chat here. So if anyone's interested in what James is about to go through, we have that link to request a demo in the chat. So James, you want to take it away here?
Yeah, absolutely. Thanks for the setup there, Jacob and Dan. Really appreciate the compelling conversation around CareStack. And what we're looking to do is, because of this relationship, because of this partnership, if those who are interested in learning more about both Rectangle and CareStack and signing up for both, you'll receive up to $1,500 in value as a new client between the two of us. Simply click on the link in the webinar chat to go through and access that demo. And the one thing, every webinar I have an opportunity to do, I think the most important thing that we all can be and can do as a steward of our organizations is just be curious, being willing to take a conversation and seeing what else is out there. We understand some conversations aren't as quick moving as others, but just understanding and knowing what's in the marketplace is a really, really important place to exist. So again, my call to action to everybody is just be curious about what's out there. And we hope that you're curious enough to learn more about Rectangle Health and CareStack together.
Awesome. Thanks, James. Well, I'll take us home here just with a few quick reminders. We are going to have a survey pop up at the end of this presentation. So when you log off, that survey is going to pop up on your screen. Please fill that out so we know how we did and we can continue to provide you with the best webinars. We are going to be sending out a follow-up email that's going to have a link to the slides and the recording and other follow-up resources. So be on the lookout in the next 24 hours. That's going to be coming your way in your inbox. And then, of course, we do have that link to book a demo in the chat. So please do so before we pop off. But always like to get people out a few minutes early. So with that, thanks again, Dan and James, for being with us here today. Great presentation, seeing some great feedback come in. And really appreciate everyone's time today, and we hope we'll be talking with you soon.
Thanks all. Appreciate it.
Thank you all. Appreciate it.